Yavapai County. I'm Leslie Horton, Director of Yavapai County Community Health Services. Today I'm here at U.S.VETS, and we're going to tell you a little bit more about this organization in a little bit. I'm also reporting that there's 2,176 cases of COVID-19 in our county. We're seeing a definite slowdown in the number of cases each day. Since yesterday, we've only had 9 new cases, which is the lowest rate of new cases per day that we've seen in a very long time. We are reporting 73 deaths in our county, and we're also reporting that we have 869 individuals who have been deemed recovered from COVID-19. We will be deeming more individuals recovered from COVID-19 in the coming days and weeks as we make those phone calls to make sure that those people that were tested positive back in the peak of COVID in early July, to make sure that they are recovered today and doing well. We've also seen a reduction in the number of people hospitalized in our county. Currently, we have 15 individuals who are hospitalized. This is the lowest rate we've seen in weeks as well, as we did see the peak of hospitalizations back in early July as well. So far in our county, 33,612 people have been tested for COVID. We're seeing about 200 new tests per day in our county. We would hope to see more testing happening in our county, but 200 a day is a pretty good sample size to be able to see what's actually happening in Yavapai County around COVID, how it's affecting our small towns as well as the larger communities. As we prepare to get ready for school starting, some of which started this Monday, with this downward trending data, it's exactly what we had hoped to see as we gear up for schools reopening as well as businesses reopening in our community. There are a number of businesses that have had to remain closed, including bars, gyms, water parks, and other establishments who have been asked by the governor's office to remain closed until we reached a moderate level of spread of COVID-19. Currently, we're one of only 2 counties that have reached a moderate level of spread based on the metrics provided by the governor's office and Arizona Department of Education. And those relate to both school reopenings as well as these business reopenings. As we watch this data trending downward in terms of cases, hospitalizations, and positivity rates, which we're currently averaging about 5.5% positivity rate on those tested for COVID-19. It's a good sign that we're moving in the right direction with reopenings. All of these businesses need to reference the Arizona Department of Health Services information on requirements for business reopenings. They also need to file an attestation form on the Arizona Department of Health Services website just to make sure that they are meeting the qualifications for reopening. As for schools, we realize that there's a lot of decisions facing our superintendents, principals, and faculty in schools. It's important that we support our schools in being able to reopen safely and carefully with public health in mind, but also education on the forefront. I am asking that our schools look at their plans, make sure that they have good sanitization, make sure that they have rules and regulations in place that will help protect the students as well as the faculty, but also work towards getting back to in-class education as well as an addition of online learning options for those families who are not quite ready to send their kids back to school. Today I'm joined by Carole Benedict with U.S.VETS in Prescott. They're an agency that serves our vulnerable veterans in the community. And so thank you, Carole, for joining me today.
Yes, thanks, Leslie. So glad to have the health department here sharing the important updates. U.S.VETS serves veterans who are experiencing homelessness or at risk of experiencing homelessness. In our community, we provide transitional housing along with permanent supportive housing and wraparound support, which includes counseling, case management, workforce development, and other ancillary services and outreach.
When did you move in, and how are you serving your populations from this new location?
So we moved in February. We were very excited. We have one location now. We were at different spots. We had housing at one spot, services at a different one. And so transportation back and forth was complicated. So now we're at one central location with services right on site. So we're very excited about that.
Awesome. It's really a beautiful place and a good location too here in town. And I know your old locations, you had kind of grown out of those. And so it's nice to see that you have plenty of space here. And You know, you all do so much for our veteran populations, and for years have, and you're always looking out for funding opportunities and other ways to better serve these populations, and we appreciate all that you're doing here. Have you made some accommodations during this pandemic to better serve your vulnerable populations? It seems as though in our conversations there's quite a bit that you've had to alter or change in how you operate, but still providing a very high level of services.
We have, yes, thank you. It's been a learning journey for all of us. We're in our dining hall. You can see some of the adjustments that we've made in here. There's one seat per table. So we're doing our dining meals in shifts. We've implemented hand sanitizing stations all over. We have masks available, shields. We've got plexiglass in all of our offices. We've asked veterans who are in shared quarters to sleep or feet to feet rather than head to head, so that there's distance that way. We have a cleaning company, professional cleaning company coming in, who's doing great work for us, making sure everything's sanitized a few times a week. And I think the average population that we serve, the average age is about 65. So we serve a much older veteran population. Not everyone, but some of them. So, you know, they're very susceptible. We've gone to essential duty teams. So all services are still being provided, but with less people on site, and doing some telehealth as well.
Excellent. We do appreciate all of those accommodations to making sure that we can still serve these populations, but doing it in a safe way. And so far, knock on wood,
yes.
We have not seen spread within the organizations that serve our vulnerable populations for the most part. We have, as a community, had some outbreaks in assisted living sites, and those have been very unfortunate and can be very devastating. And so I've been proud of how you as an organization and other organizations serving those vulnerable populations have really gone over and above to make sure that you're doing everything possible to protect those individuals. And so thank you for all that you're doing.
Thank you. We couldn't do it without the support of our community organizations. You know, Spectrum Healthcare tests any new client comes in for us to make sure that we're not bringing something into the general population that could potentially spread. The health department provides ongoing advice and support regularly for us, and we're very appreciative of that. And so as a community working together, we've been able to keep this from our doorstep, and we're very, very happy about that.
Excellent. So do you have any other things coming up that you'd like to tell our public about? You've mentioned some events or other upcoming exciting...
We have two exciting things. So since we had to postpone our grand opening for Liberty Point, we're planning a virtual one. And so there'll be more information coming about that in the next few weeks. We also are doing a large outreach event. We're coordinating and collaborating with the library here in Prescott, coordinating with CCJ and Catholic Charities, when we will be offering rental assistance at an outreach event at the library on August 24th from 12 to 4 p.m. We're going to be doing a second one in September in Prescott Valley, and that date and time will be determined. But we're excited to be able to offer rental assistance for people who have gotten behind on their rent due to the economic conditions right now. And so there'll be information on our website, on our Facebook page about that, and I believe on the health department website as well.
Yes, we'll be reposting that information as well. In December, we also plan a large-scale event that's called Connecting Community Symposium, and that's a partnership between U.S.VETS with Carole in the lead, the Yavapai County Community Health Services, MAPForce, CCJ, and other agencies, especially around justice and mental health and other underserved populations in our community. We get together and coordinate and plan a really good event for stakeholders who are also concerned about serving our underserved populations, and that's, like I mentioned, the Connecting Community Symposium. More information is going to be coming our way in regards to that. And so I do appreciate those partnerships where we can take our information of how we serve those vulnerable populations and all those things that we know that those populations need, also motivate our community and those leaders in our communities to help us in those efforts and help better serve those populations throughout the year. And so I really appreciate those partnerships with your agency and love working with you, and so it's always such a joy to get to promote what you do as well as help the general public to know what it is that our agencies that work so hard for vulnerable populations, what it is that you do.
Yeah, thank you. Yeah, I'm very excited. December 2nd is the Connecting Communities Symposium event. Stay tuned. There'll be some more information on that coming as well.
Is there anything else that you would like our communities to know about U.S.VETS, anything upcoming, or any other information you'd like to share?
No, I just appreciate, again, the support of our community, the support of our, county and city officials, the support of the health department, and just remember there are veterans who bravely served our nation, living in this community, who have some health vulnerabilities and are very susceptible to contracting this disease, COVID. And so I just ask everyone to please continue to follow precautions, wear your masks, wear a face shield if you can't wear a mask, wash your hands, physically distance when you're in public, and stay safe. Thank you.
All right, thank you so much, Carole. Thanks for joining me today. I think this is all very important information that people don't often get to hear. So thank you for joining me. Thank you for all that U.S.VETS and you are doing to serve these populations. And I always have to say too, thank you, Yavapai County. Yes. Thank you for all that you're doing. Follow all of those things that Carole just mentioned, the mask wearing, the physical distancing. Every bit of it is going to continue to help us bring those virus levels down in our community. Hopefully we can continue to get back to a new normal. And we have yet to see what that will look like in our communities, but together I know that we can get through this and we will be better for it in the long run. And thank you, Yavapai County. You're doing a great job. Keep up the good work, and I'll talk to you again soon.